Okay, so in the previous video, we talked about the location of the thyroid gland, the lobes, the isthmus, the pyramidal lobe, the levator thyroid glandulae, the accessory thyroid glands, and the falls and the true capsule and the venous plexus of the thyroid gland. In this video, let's continue talking about the relations of the lobes. Now, the first thing you have to remember is that the lobes are conical in shape, okay, having an apex and a base. They have two borders, which are the anterior and posterior border, and three surfaces, which are the lateral, medial, and posterolateral. Now, contrary to what most of us imagine, the anterior border is actually this border, and the posterior border is located here. So this is the anterior view, and this is the posterior view. This is the anterior border, and this is the posterior border. Now, owing to its anterolateral position to the trachea, our three surfaces would be the first one anterolateral, the second medial, and the third posterolateral. Okay, it's actually something like this. Okay, so it's got the anterolateral border surface, the medial surface, and the posterolateral surface. Now let's go to the relations of the lobes. Now, first of all, and if you've not seen the previous video, I first of all want to mention this is a transverse section of the neck. Okay, so if I cut it like this, and if I put the anterior border here and the posterior border here, this is what I would see. Now coming to the lobes. Okay, now the apex is directed upwards and slightly laterally and related to the middle thyroid cartilage, as we have seen. And the base is on the level of the fourth or the fifth tracheal ring. Now you have to note that the apex is limited superiorly by the attachment of the sternothyroid to the oblique line of the thyroid cartilage. So let me show you that in this diagram. Right, so the apex is limited by the attachment of the sternothyroid to the oblique line of the thyroid cartilage. It's extending from the manubrium to the thyroid cartilage. Now, the clinical anatomy relevant to this is that an enlarging pole of the thyroid gland tend to grow downwards and not upwards because it cannot expand beyond the attachment of the sternothyroid muscle. Pathologically enlarged goiter extended behind the sternum is termed retrosternal goiter. So because of this attachment of the sternothyroid, the enlarging pole tends to grow downwards. Now coming to the two borders, we have the anterior border and we have the posterior border. Now the anterior border is related to the anterior branch of the superior thyroid artery, and the posterior border is related to the inferior thyroid artery, anastomosis between the superior and inferior thyroid artery, and the parathyroid glands. Now, to understand this better, I would suggest you to watch the video on the arterial supply and the nerve supply and the venous drainage of the thyroid gland. But for now, remember that the anterior border is related to the anterior branch of superior thyroid, and the posterior border is related to the inferior thyroid artery, anastomosis between the superior and inferior thyroid artery, and the parathyroid glands. The applied anatomy relevant to this is that in partial thyroidectomy, the posterior parts of both the lobes are left behind. This avoids the risk of simultaneous removal of the parathyroid glands and also post-operative myxedema caused by the deficiency of thyroid hormones. Okay, so now let's continue by talking about the surfaces of the gland. Now we've already seen that it's got three surfaces, which are the lateral or the anterolateral, the medial, and the posterolateral. Starting with the lateral surface, we see that it's convex and covered by four muscles, which are the sternohyoid, superior belly of omohyoid, sternothyroid, and the anterior border of the sternocleidomastoid. So you can see here, this is the sternohyoid, this is the superior belly of omohyoid, this is the anterior border of the sternocleidomastoid, and as we have already seen, this is the sternothyroid. Now let's see it in the transverse section of the neck. We would see this is the lateral surface and this is the sternothyroid, sternohyoid, omohyoid, and the anterior border of the sternocleidomastoid. Moving on to the medial surface. as in the location of the gland, it's quite evident that it's related to two tubes, which are the trachea and the esophagus. It's anterolateral to the trachea. Hence, you can easily remember that it's the trachea and the esophagus. Two muscles, which are the inferior constrictor and the cricothyroid. And two nerves, which are the external laryngeal and the recurrent laryngeal. These also supply the gland and the muscles, so it's easier to remember it that way. Now the last surface we have left is the posterolateral surface. It is related to the carotid sheath and overlaps the common carotid artery. So with this, we are done with the surfaces and the borders of the pyramidal lobes. Now let's go on to the relations of the isthmus. Now we know that isthmus connects the lower part of the two lobes, and it's got two surfaces and two borders. The two surfaces are the anterior surface and the posterior surface, and the two borders are the superior and inferior. The anterior surface, like the lobes, is covered by fascia and skin and is related to two muscles, the sternothyroid and the sternohyoid. The posterior surface, as it lies on the tracheal rings, it's related to the second and the third tracheal ring, and it may be placed at a level higher or lower. Now the upper border is related to the anastomosis between the right and the left superior thyroid arteries, and the lower border is related to the inferior thyroid vein, which leaves the gland at this border. Okay, it might also be related to the thyroidema artery if present. So we have seen that the isthmus, the anterior surface, is related to the muscles sternothyroid and sternohyoid. The posterior surface is related to the second and third tracheal ring. The superior border is related to anastomosis between the anterior part of the superior thyroid artery, and the lower surface is related to the inferior thyroid vein. So to quickly recap the relations of the thyroid gland, we have in the relations, we have studied the relations of the lobes and of the isthmus. In the relation of the lobe, we saw that it had three surfaces, which were the lateral, medial, and posterolateral, and two borders, which were the anterior border and the posterior border. So I guess with this, we can wrap up this lecture, go on to the next video to know more about the arterial supply, venous drainage, and the nerve supply of the thyroid gland. Thank you so much for watching, and stay tuned.